So good morning, everyone, and thank you for joining us today. My name is Heidi Bush. I'm the Membership Director at the North Suburban YMCA. In that role, along with my team, I bring a variety of programs to our community, including social networking opportunities, a caregiver support group, brain games, and the YMCA Education Series, which you are attending today. And it is my pleasure to welcome you to Healing Neck Pain Naturally, with Denise Schwartz. Denise is a licensed physical therapist, specializes in treating pain using a holistic approach to discover the root cause of pain and provide natural healing options. So I will turn it on over to Denise.
Okay. Hi, good morning, everyone. Oh, I guess it's good afternoon. Since we are recording, if you don't want your picture in the recording, I suggest you hit the stop video button. And then please hit mute as well, so we don't have any sound behind you. Heidi might need to mute everyone. There we go. Robbie, hit down in your left corner is a video camera. Hit that, tap on that button. Okay, I am going to put everybody, a second here. Heidi, let me know. Oh, am I sharing? I have to share the screen. Damn it. Hold on 1 second. Heidi?
Yes.
Okay. 1 second. Okay, you can see the PowerPoint, right?
Uh-huh.
All right, let me get one more thing I want to make sure you can see. Can you see the mouse here?
Yes.
Okay, cool. All right, we are good. And I hid everybody, so I can't see you. I can't see you raise your hand. So please, if you have any questions, you can write them in the chat box or save them to write them down at home, save them till the end, and I'll be happy to answer any questions that you might have. All right, I think we're good to go. Welcome. This is a seminar on healing neck pain naturally. My name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. We use a whole body approach of traditional and non-traditional therapies to get people back doing the things that they love to do. Some of the things that you might want to get back to doing are that your neck pain might be limiting you. Here's me kayaking in Alaska. It was a wonderful time. Maybe you want to get back to playing golf or go on a vacation or hiking, or maybe you just want to be like these women. These women were unbelievable. I met these women down in Tampa when I was doing a half marathon, and you can see this lady had a birthday hat on, 80 years old that day, and these two ladies were 70 something, and they had just walked the 5K and the 10K and were intending to walk the half marathon the next day. So use them as inspiration. Their next goal was to walk across America, and I kept in touch with them, and they did succeed in doing that. So really outstanding. But maybe you don't have those goals, or not that aspirational, but maybe you just want to have fun with your friends and not be in pain. I know pain is very limiting and can be a problem functioning, and just doesn't make you happy, and it's tiring. So maybe you just want to get back to having some fun.
Roberta.
Or
I forgot
you just want to be able to function normally.
Maria, 12:30.
Robbie, can you please hit mute, or Pam, excuse me, Heidi, can you mute everyone, please? This lady.
Oh, mute. Okay, I hit it.
I don't know. Okay. Maybe you just simply want to get back to being able to sleep okay without a problem. So those are reasonable goals. And when you come in for physical therapy, we want to work with you to get you back to doing the things that you love to do. We use some non-traditional techniques, which are much more gentle and a much more holistic approach of hands-on therapy, as well as the exercise approach of looking at your whole body and what might be limiting you from healing. I also have a subspecialty to work with runners. I do running analysis if you know anybody who does that. Here's my son. I'm taking a videotape of him. But you are here today to learn about neck pain. And it's really annoying when your neck hurts. So today you're going to learn the 4 common causes of neck pain that I see in my clinic. Certainly there's other issues that may be going on. But at this point, this is most common. You're going to learn about the anatomy of your neck and the musculature, and then finally what you can do about it. So what are the common complaints that people have? Obviously, they might have neck pain. However, that pain might travel up into the head, giving you headaches, or it travels down your arm, and it could just be into your shoulder or upper arm. Or you might have pain all the way down the arm, or you might have numbness or tingling all the way down into your fingers. Oftentimes, it's just a specific finger that might have it. It's not usually the whole hand. If it's the whole hand, it's more than likely carpal tunnel coming from your wrist. But usually, if it's coming from your neck, it would be 1 or 2 fingers. And depending on which fingers it is, gives us some clues on where in your neck is the problem. I would say the biggest complaint other than pain that people have is a loss of mobility, such as not being able to turn your head sufficiently to do shoulder checks while driving, or just turning your head to look at something. Sometimes people just have pain on one side where they can't turn their head, and it's really like a very sharp pain. Some people just have this gnawing, achy feeling. Dizziness, vertigo, that sometimes goes along with neck pain. Hand weakness, and then of course all these issues can limit your ability to function on day-to-day things such as sleeping, sitting, standing, walking, doing your hair, working on the computer, even walking. I had a woman, her neck would start hurting as she was walking. So the 4 most common causes that we're going to talk about today are arthritis and or stenosis, herniated disc, and I divided up the musculoskeletal into 2 things. Musculoskeletal meaning your muscles and your bones. One is more the muscle area, the soft tissue, and I attribute this to a postural weakness or a strain in a muscle somewhere. The other issue is skeletal, that there is a change in the way your spine is aligned, where the ribs are a problem. So that's usually a bony issue. I offer an ebook to you if you'd like, if you put your name on tips on how to take care of yourself throughout the day. So if you put your first and last name and your email in the chat box, I'll be happy to send you this ebook for tips on how to function. So you can either manage your pain, prevent pain, or even maybe get rid of your pain. All right, so let's take a look at the anatomy. Here is your spine. Up here, you can see here's the head, so that's your skull. And below that is your cervical spine or neck. And there are 7 vertebrae. Next is your mid-back or your thoracic spine. There are 12 thoracic vertebrae. And then your low back is made up of 5 lumbar vertebrae. Below the lumbar vertebrae is your sacrum, and below that is your coccyx or tailbone. This is your pelvis. In between each vertebrae are discs that sit in what we call the body of the vertebrae. And then behind that, you can kind of see a little space here. That's where your spinal cord comes through and attaches to your brain. Here's a little bit better picture. Okay, and this is your neck. You can see this yellow is the spinal cord going down through a hole, if you will, through all the vertebrae. And between each vertebrae is a nerve that comes off. And those nerves travel down to your arms. The ones from your neck all go down to your arms. The thoracic goes through your rib cage to your trunk, and then the lumbar goes down towards your legs. At any rate, sometimes, so this nerve comes out here. All right, now here's a front view of your spine. So you can tell this is the front. So if we're looking in forward, you can see here's your cervical vertebrae. This is the disc between each vertebrae. This is your clavicle or collarbone. And this is your first rib. People are often surprised when I tell them about that. Everybody knows you have a rib cage and then it goes around your chest, but there's 12 ribs that attach to the 12 thoracic vertebrae. And the first one starts right here, right at the base of your neck. A lot of times, this is the actual problem. So when I get particularly younger people, they come in and like, you know, I slept funny and now I can't turn my head. Usually what happens is a muscle on top of here spasms and kind of pulls a little bit on this rib, kind of putting a little bit of a glitch between the rib and the thoracic vertebrae, almost as if like you have something stuck in your tooth and, you know, you just, nothing can take care of that pain unless you get rid of that thing between your teeth. That's what this feels like. This is what I call an elevated first rib, where this feels like it's a little bit higher and kind of shifted off of that vertebrae. And there is an easy technique to take care of that. Here's another side view of your neck, where you can see that the spine comes down from the brain all the way throughout the whole vertebrae. And the discs sit in front, and here's the front of your neck. Go back here. Now, I didn't put a picture of all the muscles that surround your neck. There are a lot, so it was just too much to get into. But you could strain a muscle in the front of your neck, which is actually what whiplash is. Okay? That's actually a strain of a muscle that goes from here down in the front. So if you think about a whiplash injury, usually it happens when you're hit from behind and your head goes forward really hard and back really hard. And so it pulls and you get a strain of this front muscle in here. Even though your neck hurts, that's actually the problem. You have a lot of muscles back here. There's these little muscles here that play a really, really important role in how you function in your life. We call this area the suboccipital space. We call this joint the AO joint. This is the occiput, and this is the atlas, the first vertebrae. There are these little muscles here. That's really fascinating. When you move your eyes, these muscles activate to stabilize your head on your body. So if you want, if you have good sensation in your fingers, you can put your fingers at the base of your head. And if you look to the right and to the left, you will feel those little muscles kind of rolling across your fingers. Now, I've been using my hands for many, many years, so they're really trained in how to feel things. So if you don't feel it, don't feel bad, but they are working. However, sometimes these muscles just aren't working as well as they need to. The endurance in there is poor. And then people lose their balance really easily. That's one aspect of it. So think about, let's say you're walking down the street and you look to, you hear a noise and you're looking, or you see a car and you turn your head and you take a step. And let's say you step on even a little pebble, you might lose your balance because this joint doesn't know what it needs to do. So very important, a joint that we're going to work on in addition to working on taking care of your pain. Okay, so now let's talk about the diagnosis. How do we know what's causing your symptoms? What's the limiting factor? What do we do about it? So the most common thing that we see is arthritis or stenosis. So arthritis is a degeneration of the bone. A stenosis is a narrowing of the canal where the spine goes through, or this space called the foramina where the nerve goes through. And I see a lot of this where you have like arthritic changes and it makes this space narrower, thus we call it a stenosis. And then it gets impinges the nerve, and then you get pain in your arm, numbness in the arm, tingling. And I see this a lot. People with arthritis, really, sometimes the first thing that they find before they even have neck pain is that they just can't move their neck as much as they used to. It kind of crunches when they turn their head. And that really disturbs people, even though it typically doesn't mean a whole lot. We don't quite know what all those crunchy noises are. We can make some guesses. It could be fluid changes, pressure changes. Those of you who maybe have had really severe knee arthritis, it's really the bone rubbing on the bone. And that could be happening in your neck too. But otherwise, we don't quite know what all those crunchy noises are. At any rate, most people with arthritis definitely have a loss of mobility in their neck, and then they start getting stiff pain in their neck as they get older and they get going on. The other issue is if they have weakness, numbness, or tingling, it might be in both arms. Sometimes it's just in one arm. A herniated disc is typically only one-sided. Typically, if they turn their head to the direction where that herniated disc is, that will cause more numbness, tingling, or pain down the arm. They usually will have a loss. They'll have some neurological sign. The reflexes might be a little bit diminished. Their sensation in the arm might be a little bit off. What I usually find with a herniated disc typically is they really have it in their fingers, some numbness or tingling in their fingers. I don't find with the arthritis or stenosis that people have tingling into their hands as much. They may have they'll have weakness in their arm and maybe some reflexes, but the tingling in the fingers aren't as strong. It's usually more of like upper shoulder pain. Okay, a skeletal problem, and I talked about this before, is someone who comes in and says, I slept funny. I moved my head and all of a sudden it got stuck. It feels like I just can't turn my head. These people will tell you that Advil doesn't help, Tylenol doesn't help, Vicodin doesn't help, because it's kind of like that thing stuck in your tooth. Nothing's going to help until you get it out of there. So this is usually that elevated first rib. That does not mean that the first rib is dislocated off of the thoracic vertebrae. All it means is that the muscle tissue, which would be about right here, is kind of tugging on that rib and not allowing that vertebrae in the rib to move the way it's supposed to. So there are some hands-on techniques that we do for that. And in fact, I have intention of creating a video on how you can take care of that yourself. And I hope to do that in the next couple of weeks. So again, if you put your first and last name and your email in the chat box, you will be able to get that email with a video on how to take care of this problem. I had my sister-in-law never asks for help. And she gets pains off and on, and she's pretty weak. Anyway, she had severe neck pain. She just couldn't turn her head, and she wanted me to see her, and I really didn't have a whole lot of time, but I figured out that it was probably this first rib issue. So I got on a Zoom call with her and my brother, and I had my brother do the technique on her, and he was successful. The next day she called me, she's like, it was like a miracle. It's all gone. Advil didn't help, Tylenol didn't help. She needed this little oomph to get it back into place. So There is some easy things you can do. Now, you might have this problem, but you might also have some of these others as well. So we have to look at both those and figure out which one it is. Another skeletal issue is you might have something going on in the vertebrae itself, up in the neck, where one of the muscles in the neck is a little bit spasmed and it kind of pulls on the vertebrae and kind of holds it into place. So then when you go to turn your head, it won't allow it to move the way it needs to. And so then again, you feel sort of stuck. The best treatment for that, of course, again, is some hands-on to kind of get the better joint play between the joints there. It's not a cracking. It's really about just applying and getting those joints to work optimally for you. The upper thoracic, let me go back here. No, I don't have that. Okay, it's a side view. So when you turn your head, all these cervical vertebrae turn, like if you're turning your head to the right, they all turn with you, and so do these upper thoracic vertebrae. Many times I often see that this area is just so stiff that it doesn't move. So when someone turns their head to the right or left and this doesn't move, they can't go as far as they need to, and they just feel all this pulling maybe in their neck or in their shoulder as you're trying to get more movement, but we need to address this upper thoracic spine. And that could be a problem of posture, postural changes. It could be from sitting. It can be any number of things. Sometimes people will have jaw pain or ear pain. The jaw or TM joint, temporomandibular joint, sits at the top of the spine. And then the ear canal sits just above that. So they're very interrelated. So we need to look at if you're having jaw or ear pain or neck pain, we look at all those pieces to see, are they playing a role? Is that affecting that area? So we all want to look at that as well. And then, of course, as any of you who may be on this call have had neck pain in the past, I'm sure you've had some headaches along with that as well, because it can go up into the head. When you can't move, everything stiffens up, and then you get head pain, or you're just so uncomfortable, you might clench your jaw, you get the jaw pain. So there's a lot of pieces that go into this. And then one of the last things that we see that's really more of a skeletal issue, it could be the cause of your vertigo. I also hear migraines. I have a woman right now who've had migraines since she was a child, and she's 30 some years old now, and she was recommended to come into physical therapy because her migraine doctor suggested it might be coming from her neck. I don't know how the doctors diagnose all the different kinds of migraines. However, there is a type of migraine that does come from an issue going on in your neck. We call that cervicogenic. So you could get a migraine coming from your neck, or you could get vertigo coming from your neck. And so we have to differentiate why you might have a migraine or why you have the vertigo. And if it's coming from your neck, then there are some things that we can do to help with that. And that usually has to do with the bony alignment in your neck. Soft tissue issues. Remember I said there were two different musculoskeletal pieces, one being bony, one being soft tissue. Soft tissue is everything else other than bones. Muscles, tendons, ligaments. I guess we wouldn't call organs and blood vessels as soft tissue, but those are other types of tissue that may play a role as well. The biggest piece I see with a soft tissue issue, that you might have the stenosis, you might have arthritis, you might have a skeletal issue, and you might have postural weakness as well. You will also have postural weakness along with those pieces. However, I see a lot of people who don't have arthritis, who don't have a herniated disc, they do not have that first rib issue, but they have neck pain, and it's because of their posture. So if you see this picture here, you can see here's what we call a relatively normal posture, where you have a curve that goes in at the neck, curve out, and a curve in down on the low back. But if you look around, there's people who look like this, and then look at where their head and neck are. They might look like here, they're sort of hunched over, so now their head is looking down, and so that strains their neck. Here's another position. Here's someone who's standing up so straight, and they throw their shoulders back, and then they have to accommodate with their neck. So what's going on below your neck in the postural positioning and alignment here is like a scoliosis, will affect your neck pain. So if you come in and you tell me you have neck pain, and I look at you and we really determine there's really nothing significant going on in your spine, and I tell you it's weakness, you need to work on everything below so this can hold your body upright so you don't strain your neck so much. Now, sometimes people, particularly as they get older, their spine changes, and we're really not going to make any changes in the significant change here or the scoliosis. What we need to do is get you as strong as we can and get everything working together as best we can. And that's what I call that whole body approach, and really looking at what are all the pieces going into play here. Someone with postural weakness or core weakness, I get that a lot with young women, particularly in their 20s or 30s. You know, they're relatively new out of school, and now they're sitting all day at a desk, and they tell me they have pain at the end of the day. And it's because they're just not used to sitting there, and their core is very weak. Okay, so it's about really working on getting yourself stronger. Sometimes you'll have poor balance with that as well. We talked about whiplash, which is a strain of the front neck muscle here. I've had people who have pain in their neck because they don't breathe with their diaphragm optimally. They tend to use what we call the accessory muscles, which are the muscles, these little muscles in their neck. They use them and they kind of breathe here, up in these. And so these muscles are getting overused, and they're little teeny muscles, and they're not designed to do all your breathing for you. And so they get strained and sore and tired. So we have to work on your respiration. Neck or arm pain, and we talked about that. Upper back pain, the base of the skull. Remember I talked about that within how important that joint is and how it plays a role with your vision. We use our eyes a lot to stabilize and work on our balance. And if you close your eyes and you have trouble balancing, this little joint here really has to come into play. So it's very important that we work on all of these. Posture, here again, if this is just a little bit off down below, up above has to accommodate, and it might get sore or tired or in pain. All right, so what do we do about this? First off, we want to know, if you come to see us, will physical therapy help? So what we want to know is, your symptoms or pain reproducible? And what does that mean? That means something you might tell me, such as, when I turn my head to the right, I get severe pain or numbness down my arm. But if I sit and I look straight ahead, I'm okay. That's reproducible. You tell me it hurts when you walk, but if you sit down, you're okay. That's reproducible. What's not reproducible is if you have pain all the time, you can't find a comfortable position, sleeping is a problem, it's always achy and sore. It's iffy that therapy can help, okay? Again, if you put your name and your email in the chat box, you'll get this PowerPoint, and you can read some success stories that people have had coming in with their neck pain. Here was a former physical therapist who was doing yoga training, and her shoulder and neck was just getting worse and worse. And she came in and we got her back to doing her yoga. So she was very happy. What is the biggest mistake that you can make with neck pain? Is ignoring it. It's really, if you can come in sooner than later, it really will make a biggest difference to get you feeling better as soon as possible. I love to throw this picture in. I went to Alaska last year, and this is a glacier. That's me, actually. This sign says the year 2005. This is where that glacier has receded from. So don't ignore your symptoms, otherwise things could get worse. Okay, so what are your choices? We talked about ignoring it. Maybe it'll go away. You could get medication, injections, or surgery. There is a place for these things. Or you can handle it, meaning you come in for some physical therapy so we can teach you how to take care of yourself, help you get rid of the pain, or at least reduce it and learn how to manage it. I often find that a combination of some medication or an injection plus the therapy is helpful. Oftentimes, just therapy without medications is helpful. And of course, there is a place for surgery. Okay, so what do we do in physical therapy? We do some hands-on therapy, which we call manual therapy. We do some work on the joints. That's the skeletal system that we talked about. And that's about getting those, you should have a normal amount of movement in your joints. So it's about restoring and balancing those joints out. We will work on your soft tissues because, again, if the soft tissue is really restricted or there's scar tissue, that may be inhibiting you from healing. And we'll use some non-traditional and traditional techniques. What does that mean? A traditional hands-on technique is find the sore area and force it to move. There's a place for that. A non-traditional technique is find that sore spot and work with your body in a much more gentle way to get your body to learn how to heal itself. Education, education, education. This is the biggest thing that we want you to learn when you come to physical therapy, and from my ebooks and from my website and YouTube videos, is how to take care of yourself so you don't get injured and in pain. We'll teach you about your posture, how to function, improve your movement, how to just take care of yourself as your day goes on. Was anybody taught how to sit correctly? Did you learn how to walk the right way? Did you learn the best sleeping position? These are things that, we just did, right? Something, let's say you're working. I had a woman who was a flight attendant, and she always worked in first class. And so she was always having to serve meals. And so she was bending down, opening doors and moving carts and taking trays out. So we simulated that in the clinic so she wouldn't cause any more neck and back pain. Exercises to strengthen up your core, get your body working together, improve your mobility and your stability. So balance exercises as well as mobility exercises to make sure all your joints can move as optimally as possible. And then more importantly, what we call neuromuscular re-education exercises. That's to get your whole body working together the way it's supposed to. So remember we talked about different postures and how your neck had to accommodate to different postural changes from below. And so we need to get stronger from below, from your feet all the way up, so then your neck has a stable base to stay on. These are all the different things we talked about. Okay. One of the best tools I have added to my practice in the last 3 years to teach your body how to use your core is an OOV. Somebody looked at it and called it an OOV. It was created by an Australian osteopath, and he's also a biomedical engineer. This device works your body three-dimensionally, so you cannot compensate. So no matter what position I have you in, on your back, here is an older gentleman. I have it between the wall and his back. Here's another older gentleman stepping over it. And here's my son doing a more advanced technique, standing on it in one leg. So no matter what position you're in, your body will subconsciously use your core muscles the way it's supposed to. That for whatever reason sometimes turns off. He has now created a new device called a balance sit. So you can sit on this to strengthen up your core as well. I really have been a PT now for 35 years, I think. And I think this is really one of the best tools that have been added in the last number of years to really get your body working the way it needs to. So we don't like to give you exercises to do because everybody is different and what you need and what you don't need. However, there are some tips that are helpful, particularly for neck pain. Sleeping. If you sleep on your side or on your back, make sure you use a pillow that fits the space of your neck. Please don't sleep on your stomach. When you sleep on your stomach, your head has to be turned all the way to the right or left the whole night long, which will cause early degeneration and more pain. Movement. Some things that you can do. I recommend not moving your head on your neck. I recommend moving your body on your neck. When that looks like, I'm going to do it in sitting, it's just turning your shoulders like this. And so my neck is getting movement, but from below instead of above. You can use ice or heat on your neck, whatever you like better. Really just for an analgesic for pain relief. And then we need to get going on some exercise, and that I always recommend getting guidance from your physical therapist or personal trainer. Again, get this ebook will be helpful. And here are some success stories that you can read about. And as a thank you for coming today, I'm offering a free phone call or telehealth session to discuss what's going on with you and provide you with any recommendations. Okay, so you can call my office, 847-541-7600, and my admin Jenny will set up a phone call with me, or you can email me and let me know what's going on. I am going to stop the share here and answer any questions, and I'll take a look in the chat box to see if anyone has any questions. Let's see. Do you have any recommendations for types of pillows? I wish I did. My favorite pillow that doesn't exist anymore. So recently I have to buy some new ones, and I haven't tried them. I bought them for my daughter down in Florida. I just Googled what are the best pillows for side sleeping, and we did come up with a couple that looked pretty good. So I have to reevaluate that. So I apologize. I don't have anything good right now. But you want to make sure when you test it out, they do divide up the pillows into side sleep. No? Well, thank you for coming. I really appreciate it. I hope you learned something and you can feel better. I'm gonna, Heidi, I need to copy this. Shoot, I always forget how to copy the, wait. There we go.
While you're doing that, I want to say thank you to everybody for joining us today. The YMCA Education Series is free and open to the public. And as a 501(c)(3) charity, we do rely on fundraising to help us serve the community. If you enjoyed today's presentation and want to help us continue to offer free programs like this, we welcome your donations at the North Suburban YMCA. You can visit our website at www.nsymca.org to donate and see all that we are doing and planning. Thank you, Denise. That was really fantastic.
Thank you. Appreciate it.
Have any questions?
Thank you for having me, and everybody have a happy Thanksgiving and happy holidays. I'll see you next year.
Thank you so much.
Bye-bye.
Bye, everyone.